Greetings to all, my dear students. Good evening, one and all. Let us talk one more topic under biochemistry. That is, the title of the topic is atherosclerosis. Let us see the objectives of the atherosclerosis. What are the factors we have to know here? The first objective, we have to know what is atherosclerosis. And second one, we have to list out the factors which are responsible for the development of atherosclerosis. And finally, we have to identify preventive measures for atherosclerosis. Here we can see how we can define this atherosclerosis. Atherosclerosis can be defined as which is considering as with high level of serum cholesterol which result in atherosclerosis. We can define clearly the atherosclerosis which is characterized by hardening and narrowing of the arteries due to deposition of cholesterol and other lipids in the inner arterial wall. We all know that the structure of the blood vessel. So this blood vessel in the normal artery there is no fatty deposition will not be identified. Whereas in the other blood vessel, we can identify here there is a sticky deposition or flake formation, the inner layer of the artery. So that will leads to there is a blockage of blood circulation towards the other organs. I hope that now we understood regarding what is atherosclerosis. Once again, we can discuss this. The atherosclerosis is characterized by hardening and narrowing of the arteries due to deposition. What is going to deposit here? There is a deposition of the cholesterol. Where it is depositing? It is depositing in inner arterial wall. In where it is depositing? It is depositing in the inner arterial wall. Then, the deposition of cholesterol and other lipids in the inner arterial wall leads to the formation of flake, or it is also known as sticky deposit, and result in the endothelial damage. So, what is happening here? There is a damagement or damage can be occurred to the endothelium and narrowing of the arterial lumen. When there is a fatty deposition is identified in the arterial lumen, what will happen? The artery will become narrowed. This narrowness will cause it to factor for diminished blood circulation to the other tissues. And the hardening and narrowing of coronary arteries result in coronary heart disease. So we know regarding this coronary arteries. So what is the importance of this coronary arteries? Coronary arteries mainly giving blood circulation towards the heart. When this coronary artery is getting blocked by this fatty deposition, blood circulation will not be received by the heart properly. Then we can see the other concept is here HDL cholesterol. This HDL cholesterol, high density lipoprotein. HDL cholesterol is also considering as a good cholesterol. It has protective effect against atherosclerosis. In our body, when there is a high density lipoproteins or also known as good cholesterol, when it is good amount in our body, we are free from or we are protective from the against atherosclerosis. HDL transports cholesterol from peripheral cells to the liver for excretion. So what the concept here? HDL, this high density lipoprotein which is going to transport the cholesterol, excess cholesterol, whereas it is present in the peripheral tissue, it is transporting from peripheral cells to the liver for excretion. The higher levels of HDL, the lower are the risk of atherosclerosis. What we understood here, in our body, when there is a higher level of HDL, that is good cholesterol, we are the low risk for the atherosclerosis. And low level of HDL cholesterol is associated with the atherosclerosis. Controversially, we can identify here in our body when there is a this cholesterol level, good cholesterol level will be decreases. That will becomes to the that we may prone to developing the atherosclerosis. Then other concept we can discuss under atherosclerosis, that is factors responsible for the development of atherosclerosis. Let us see one by one. The first factor here, that is age. So how the age is constitutive factor for development of atherosclerosis. Aging brings about changes in the blood vessel. So once our age is increasing, advanced aging conditions, our blood vessel is undergoing certain changes. The arterial wall due to decreased metabolism of cholesterol. So aging brings about changes in the blood vessel wall due to decreased metabolism of the cholesterol. Metabolism of the cholesterol is going to be decreases when our age is increasing. As age advances, the elasticity of the blood vessel decreases and leads to turbulent blood flow causes mechanical injury of the arterial wall. So once the age is increasing, the elasticity nature of the blood vessel is going to be decreases. That causative factor for decreasing of the blood circulation, which causes mechanical injury of the arterial wall. Then other factor is gender. So here we can see this, males are affected more than females. Female incidence increases after menopause. So usually, basically, the men is more prone to developing atherosclerosis than the female. So after what will happen? Once the woman is attaining menopause, in that cases, the both gender is both are equally risk for development of the atherosclerosis. Then menopause, we can notify what is the terminology of this menopause. Menopause means complete cessation or complete stoppage of menstruation from the females. Then sex incident is equal after 65 years. Once maybe the woman may undergone menopause after maybe 50 to 55 years, but after once any gender is getting their advanced age over 65 years, they are more prone to risk for the atherosclerosis, which suggesting that male sex hormones might be atherogenic. What are the hormones is present in the men? It may be having causative factor for development of the atherosclerosis, or conversely, that female sex hormones might be protective. What are the hormones which is present in the woman, that will be considering as a protective factors for the prevent for person maybe away from the atherosclerosis. Then another factor is hyperlipidemia. So what do you mean by hyperlipidemia? Hyper means increasing lipids. The cholesterol level is going to be increasing in the blood. Hyperlipidemia is the major risk factor in patients under 45 years of age. So the an average person age below 45 years, in that cases, in their blood, there is a cholesterol level will be increases. These people or these population are more prone to development of the atherosclerosis. Then another factor is genetic factor. So that we know that hereditary genetic dearrangement of lipoprotein metabolism, which leads to the high blood lipid levels. So what, because of what, there is a dearrangement of lipoprotein metabolism, which causes high blood lipid levels. Then another factor is level of HDL. So as I told you already, HDL means high density lipoprotein. When this high density lipoprotein is good in our body, we are free from atherosclerosis. If that HDL is going to become as a low, that is low level of HDL is associated with atherosclerosis. Then coming to this, HDL has protective effect against atherosclerosis. HDL participants HDL participates in reverse transport of cholesterol. To transport cholesterol from cells to the liver for excretion in the bile. The higher the level of HDL, the lower the risk of ischemic heart diseases. Then another factor is hypertension. Hypertension is a major risk factor in patients over 45 years of age. It acts probably by mechanical injury of the arterial wall due to increased blood pressure. Once a person is having that severe hypertension, that may be causative factor for there is a mechanical injury of the arterial wall which causes increased blood pressure. Then another factor is cigarette smoking. Cigarette smoke reduces the level of HDL and accumulating carbon monoxide that causes endothelial cell injury. So we know that the harmful factors towards the cigarette smoking. The cigarette smoking may be or it reduces the our level of HDL in the blood. Then another factor is diabetes. The risk is due to the obesity, hypertension, and hyperlipidemia. So, because of the diabetes, the person overweight, that is known as obesity, and their blood pressure also is going to be increasing, that is known as hypertension, and hyperlipidemia, high level of cholesterol levels in the blood. Then, other factor is minor or soft risk factors. The risk is due to increased LDL. What do you mean by LDL? LDL means low density lipoprotein and decreased HDL level. As I told you, HDL is considering as a good cholesterol, whereas LDL is considering as a bad cholesterol. These include lack of exercise. Why there is a bad cholesterol is going to be increasing in our body? That is because of the lack of exercise. The person may be frequently undergoing stress, obesity, and high calorie intake, diet containing large quantities of saturated fats, use of oral contraceptives, alcohol consumption, and hyperuricemia. We all know this lack of exercise, stress, obesity, high calorie intake, diet containing large quantities of saturated fats, and use of oral contraceptives. Certain kinds of pills the person may be consuming because of the hormonal imbalances, and also frequently they are consuming alcohol consumption and also hyperuricemia. This uric acid levels is going to be increasing in the blood, that is known as hyperuricemia. Then let us talk about the topic is prevention of atherosclerosis, how we can able to prevent this atherosclerosis. The most important preventive measures against the development of atherosclerosis is to eat low fat diet that contains mainly unsaturated fat with low cholesterol content. So whatever diet we are consuming, it must be it must be considering as a low fat diet. Then we have to consume natural antioxidants such as vitamins, vitamin E, C, or beta carotene may decrease the risk of cardiovascular disease by protecting LDL against oxidation. What do you mean by LDL? Low density lipoprotein. So when you are reducing our diet or when we are managing our low density lipoprotein, so this LDL is considering as a bad cholesterol. If you are reducing the bad cholesterol, obviously, we are free from atherosclerosis. Then moderate consumption of alcohol and exercise appears to have a slightly beneficial effect by raising the level of HDL. If you are controlling, sometimes the person may be having habit of alcohol consumption. They try to reduce their alcohol consumption and they have to participate exercise which will be helpful for beneficiary effect by raising the level of HDL. Then some of the drugs people may consume for maintenance of their cholesterol level, that is like lipid lowering agents, lovastatin, then clofebrate and cholestyramine, and which inhibit cholesterol synthesis. So these are the drug therapy can be used for the prevention of the atherosclerosis. Then let us summarize our topic. So far we have discussed regarding atherosclerosis. So what do you mean by atherosclerosis? Atherosclerosis is characterized by hardening and narrowing of the arteries due to deposition of cholesterol and other lipids in the inner arterial wall. And what are the factors are responsible for atherosclerosis? The factors which are responsible for atherosclerosis may be advancing age, gender, hyperlipidemia, genetic factors, hypertension, cigarette smoking, minor or soft risk factors. And sometimes habit is also a causative factor for development of the atherosclerosis. And preventive measures, we have to consume low fatty diets and some of the cholesterol reducing drug therapy we have to be consumed. Sometimes if it is not possible, the person may go for the surgical removal of affected part, that is atherectomy. Atherectomy also can be performed. In that cases, what will happen? Which blood vessel is undergoing the blockage, that particular part is going to be removal, or the fatty deposition where it is located in the blood vessel, that is going to be removed. That is known as atherectomy. Atherectomy. I hope so that till now we have discussed regarding atherosclerosis. You understood well. Thank you, one and all. Have a nice day.